The first uh, question that is asked is, how do you get over the depression that comes from losing a loved one? How does one get over depression that comes from losing a loved one, like a mother or a father, especially multiple losses over a close proximity?
Yes, it can be quite stressful, especially multiple losses in a short time. That's what I said about grief. Uh, it is quite natural for us to feel sad when we lose a loved one. That's the first thing to remember. And we must go through this normal grieving process. If not, we'll find it very difficult to adjust later on. So the normal process is, normally what happens is when we go to a house where someone has died, usually we'll see everyone crying, and the person will come and tell you what happened, how this person died. Then soon another guest comes, and the person repeats the same thing against that guest. This is a normal process. The more you talk about it, more you think about it, the easier it will be to come out of it. So the way to cope with that is you talk to more people, remember, look at the albums, go through the normal grieving process, and eventually you will develop the strength to overcome that. All people, when they go through a grief, they think, oh, this is too much, I cannot come out of it. But almost everyone will come out of it. That is the fact. So we need to wait, talking to various people, that's very useful, and trying to get involved in activities where you can have more socialization. These are some of the ways to come out of it. But if a person has really gone into severe depression after this, then you may have to seek medical help, may need some antidepressants. But that's not a usual case.
What would you recommend about to them? Grief counseling, would that help?
Yes, grief counseling. You don't even have to say counseling, even just talking to people. Now, many times when you think of counseling, we think there's a very technical way of counseling. You have to go to a counselor. No, even friends or well-wishers, anyone, talking to them, that will be useful, therapeutic.
Thank you, doctor. The second question that we have is, can we identify a person who's going through depression? How can we identify them before it gets worse and help them out?
Yeah, as we said, some of the early signs of depression is, their reduced socialization. They don't take part in many activities. Their facial expression, their slowness, their disinterest. We need to ask them how's their sleep. That's one of the early things to get disturbed in severe depression, their sleep, especially if they have early morning awakening. Then, of course, appetite and so on. And I have said about those three things, 3 points: ideas of hopelessness, helplessness, worthlessness. Do they have any of these things? If they have these, then they are likely to be going into depression. They may need help. And depression can be very easily be treated, clinical depression too, if they go to any psychiatrist or any doctor who's familiar with that can treat. And very simple medicine is once a day medicine. And within 3-4 weeks, they'll be out of depression. And they need to take the medicine for 6 to 9 months.
Okay. Next question we have, doctor, is if a person has been assaulted in childhood and they haven't talked about it to anyone, can they get depressed?
Yeah, when I say these risk factors, we cannot automatically connect saying that if somebody is assaulted, they'll surely get depressed. Not like that. It is a risk factor. If somebody had been abused, assaulted, or any traumatic incidents in their childhood that is less than 11 years old, they found that many people in later life, they develop depression. That's one of the risk factors.
Okay. Another thing is more details about asthenia, please, reasons and triggers.
Sorry, say it again, please.
Asthenia.
Dysthymia, okay.
Yeah, reasons and triggers.
Dysthymia is usually a chronic low-grade depression. And people feel very low and disinterested. in many things, but not severe enough to affect their daily life. They don't just avoid company completely. They'll be able to work, but not as well as the others. This is usually can called as a chronic depression. Very often this is related to personality, the way a person looks at life, looks at stress. Uh, so they will probably need counseling. Uh, if it's gone on for a long time, you could try antidepressants, but not very effective. But counseling and helping them to cope with life, redirecting their interest, these are things that will be helpful for this time here.
Uh, Another question, doctor, is while research shows that more women get depressed, more men are identified as having depression as well. Why is this the case? Is it cultural?
Uh, Not cultural, it is true across the culture. Women are almost twice, or usually say 1.7 times, 1 is to 1.7 times. Women are more depressed. For the reason that I had said, mainly the hormonal, uh, then also the way they need to handle lots more responsibilities, domestic responsibilities, lot of, because men usually they go meet many people. It's not so much relationship oriented. Women are more relational, so a lot of stresses come that way. And women also have more history of being vulnerable for being abused. So these are some of the reasons why women are depressed. That's what they say. Exact reasons we don't know. These are some of the possible causes.
Okay. The other question that we have is that when we observe people under depression, they are mostly highly educated, intelligent, well placed in society, and sometimes have their trust in God. This is very disturbing. And when we look at a common man, can easily control and adapt to the situations. Uh, should a man live with no goals and no purposes and role of God? Okay. I think the question here is it to do with being intellectual, or a common man who's like a street smart also can get depressed, or is there anything that plays a factor?
Um, Anyone can get depressed, yeah, but many of the epidemiological studies show some slight trend, like people in the cities are more depressed than people in the villages. And socioeconomic status on both ends, the lower socioeconomic status and the very high socioeconomic status, they seem to have a little more people who are depressed. But they're not very, very different. Not like the men and women, one is not like that, but a little more. So anyone can be depressed, not particularly related to a person's intelligence or his social achievement.
All right, I'm almost getting around now, around hearing 75 questions. Let's see how many we can go through. I have a young nephew who is clinically depressed and undergoing treatment. Of late, he started opening up his feelings to me. He does talk to his doctor often. My question is it safe for me to encourage him discussing his feelings with me and support him? I don't want him to feel that I don't care, so I keep in touch with him.
Yes, anyone who can talk to a depressed person will be doing a service for that person. So in addition to the doctor, any family member is able to talk and the person feels open to you, that is important. But I would just like to add a word of caution. Let it not lead to a dependence on you. That we need to be careful, because depressed people, when they find somebody is understanding, they can become too dependent on the person. And then for every other problem, that person will come to you. That is not a healthy thing. Let the person talk. That is helpful. And maybe we can suggest or help him and discover some ways of coping with his condition by through some activities. That is useful.
Next question, doctor, is how can we counsel or help anyone who has hereditary depression?
uh, we need not counsel anyone who has just a heredity unless the person is depressed. We cannot prevent a person from getting depressed. That is difficult. We cannot find out. But a few things to be careful about, how learning some coping skills in terms of depression. Also, some open channels of communication. If a person feels depressed, the person can approach a friend or a relative or even a doctor in times of depression. Just we need to be aware that these people have a higher chance of getting depressed. That's all we can do. We cannot prevent somebody's depression.
I think a follow-up question, I think, will be how do you make people understand that they have a depression problem?
Fortunately, many people with depression, they themselves feel that they have some problem. Unlike many other psychiatric conditions where they feel they're quite normal, only others say that they are mad or something like that. In depression, many people, they feel they're a kind of being unwell. At least they may recognize they're not able to sleep properly or their appetite. Something they will know, even though they may not recognize it as depression. Many people don't recognize the feeling as depression, especially in India. Here, we don't talk about our mind and feelings. We don't go to a doctor. But we'll go to a doctor if you have some physical problems. That is why in many hospitals, people who are depressed will go to a medical OPD with aches and pains. And a wise doctor will find out, check and find out that if everything is normal, it must be depression. And even a non-doctor can suspect the person has a lot of physical symptoms. That is one way to suspect. And also some of the signs that we have mentioned, if you notice that, we can suggest, even if the person doesn't agree that he is depressed, it would be good to see a doctor. Or even without saying anything, can you talk to that person? Don't even use the word depression at all. Can you talk without using that word? Then you may be able to find out more and may be able to help that person.
The next question, doctor, is pertaining to spiritual and medical. I mean, India is a country which is spiritual from all realms. I mean, there are spirituality in every faith and religion and stuff like that. So I think the question that's coming here is, do we need medical treatment by all means, or can we rely on spiritual, or are both required?
Both are required. In any illness, not only for depression, in any illness, uh, a person who believes in God knows that God is in control. And we are alive because of God's grace. And we are what we are is because of God's grace. So we need to seek God's grace in every area. It's not that when a person is depressed, you go for a prayer only. Both are needed. If medicine is needed, yes, that doesn't preclude prayer. And if counseling is needed, yes, you can also have prayer. So I would say both are important.
I think this question is a bit okay. These days youngsters and many during the lockdown are not following routine, like no sleep at night, watching movies, and daytime they will sleep late. I feel this will hamper their biological systems. Please elaborate if this will lead to depression or irregular lifestyle.
Yeah. That by itself will not lead to depression, but in a vulnerable person who may, like a person with a severe family history of depression, some of this alteration in biological rhythm can trigger a biochemical change in the brain and may cause depression. But in general, by itself, it will not. But it's good for all of us to have regular rhythms in life, regular habits that will keep us more healthy.
Yeah, thank you. Because I think it's important because all young people are going to be like that. I think unless somebody is kind of vulnerable, as you use the word, right? I think that is what I think is the key. Uh, uh, Other question is, what is TMS? One of the treatment mentioned. Please
Yeah,
explain.
it is transmagnetic stimulation. Is one of the later treatment that has come. That is, they keep a strong magnet on the skull. If a person doesn't feel anything, and a few sessions is supposed to relieve depression. But this treatment is more expensive than the other treatments. It's available only in a few centers. This is one of the last 10 years or 15 years this treatment has come. The advantage is that the person doesn't feel any discomfort or anything. Even electroconvulsive therapy, person doesn't feel any discomfort. Only the onlookers find it frightening. Magnetic stimulation, the person is conscious, he can just watch, just keep the magnet, and then a few sessions helps.
In the presentation, it was said that there are biblical reference to depression also. And another question is, do spiritual leaders also face depression?
Yes, all human beings, spiritual or otherwise, can face depression, and being spiritual is not an immunity for getting depression. Yes, it's a help to prevent sometimes feeling depressed, and it's a help when you are depressed to have a good spiritual support. But being spiritual alone will not prevent a depression. There are many spiritual leaders who have gone through severe depression. I didn't show those pictures in the slides, but there are famous people like writers like C.S. Lewis, Charles. Uh, uh, there are many writers, leaders who have gone through times of depression and have come out of it.
Thank you, doctor. Panic attacks, are they
Yes.
related or are they something else? Or is there a solution? Is there a permanent solution for panic attack?
Panic attacks looks like anxiety, but it's not really anxiety. In a way, it is related to depression because the antidepressant medicines help panic attacks. So usually what happens is when a person gets panic, 2, 3 panic attacks, then he becomes anxious about the panic attacks. So anxiety about panic is called anticipatory anxiety. So usually the treatment for that is antidepressants. And it helps many people if they take it regularly.
If depression gets better over time,
Yeah.
I have had friends who have said that time has only seen them get worse. Their reality doesn't seem to correlate to this idea that in time it will all be better. How should I respond?
Well, usually depression lasts for about 9 months. For some people, it may go on for some more time. That's a usual case. For some people, they can have chronic depression. Some people have resistant depression, which doesn't respond to the ordinary methods of treatment. Then we usually suggest them stronger treatments like ECT. And not a common treatment, ECT and treatments like that. There are some people, in spite of all this treatment, they may not get better. But in general, most of them will come out of it in about a year or maybe 2 years. But usual thing is about 9 months.
Uh, do psychiatrists undermine the importance of psychological counseling for clients and try to treat them only with medicines?
A good psychiatrist should not undermine, but many psychiatrists think the easiest way, quickest way is to give them medicines. So that's what many of them do. In fact, many psychologists, clinical psychologists, counselors can give good counseling. There is a study where they say cognitive behavior therapy, in one research, they found it's equally effective as antidepressants. So there's one study like that. So we should not underestimate the value of counseling. Also, the counselors must remember not all depression is amenable to counseling, especially melancholia. Counseling alone will not help. They need antidepressants.
My question is, today Nagpur local paper reported on 4 suicides, all young people newly married as an effect of the lockdown as well. So I think there are 2, 3 questions following up this as well. How can growing, how can people help the growing depressed community? The other one is, can we talk about it without bringing religion into it, without bringing God into conversation or religion into conversation? Also, yeah, I think we'll start.
What is the first part? Going into community?
As a community, how can we be sensitive? How can we discern? How can we, what do you think we should do to help them?
Yes. Generally, as a community, teaching people the usual coping skills, which I had mentioned in my talk, of dealing with ordinary stresses in life, and to develop a philosophy of managing common stresses and looking at the future. Very, you want to use religion or spirituality or not is up to you, up to your personal faith. I believe as a Christian that spirituality is very important. Trust in God, depending on God is very important. It's a strong help to come out of depression. But you can treat. There are so many psychiatrists, so many psychologists who are not at all religious. They can also treat.
If you say Indians show signs of physical pain due to depression, I have severe headaches since childhood. Could it be could it be related to depression?
Well, you cannot say blanket like that. You need to see what is the cause for this headache. It could be that just one of the causes. Everyone who gets a headache doesn't have depression. So we need to probably get the headache investigated properly, medically. And if no cause, there are many times headaches without any cause. Idiopathic, we say, without any known cause. One of the causes is depression. That's all I can say.
Can people who put up a happy face all the time, be jolly, can they get depressed?
Yes, there's a depression called smiling depression. Some people can put a smiling mask like on their face, hiding what's inside. Can do. Some people can do. Not that every smiling person will become depressed, but people who have the ability to smile in spite of what goes on inside, called smiling depression, they can do that. But it's difficult.
Can someone be depressed for no reason at all?
Yes, that's very common. No obvious reason, no external cause, and they feel very depressed. In fact, it can be very severely depressed, even suicidal too. This is the type of depression I call as melancholia or endogenous depression due to the biochemical changes in the brain without any external triggers. Everything is fine and happy. There's no reason to feel depressed. Even the person himself will say, I can't understand why I feel depressed. There is nothing to feel depressed, but yet I am depressed. In fact, I've heard people saying, I want to commit suicide, but I don't know why. That thought comes. This is called melancholia or endogenous depression due to the biochemical changes in the brain. And this responds very well to antidepressant treatment or ECT. This is something important for us to remember. Many people suddenly feel depressed without any obvious cause.
What is your view about reductive physicalism, which says that our mind consciousness is the product of our brain? How far should we hold this view?
Mind is the product of brain. Yes,
Mind / consciousness is the product of our brain.
Yes, it is part of the functioning of the brain. Without brain, there's no mind. So, I mean, hearing it like that, I feel that's true. Without brain, there is no mind at all. The mind is part of the functioning of the brain. But we are not machines. By triggering something or putting on a switch, we cannot change our thinking. I believe we have the ability to control our mind. We have the ability to choose what we want to believe, and that in turn will affect our feelings. So it's not that we can control exactly what we want, but we have the ability to choose.
Thank you, doctor. Is there a way one can self-diagnose depression?
It's possible if a person is introspective and willing to look at himself and can diagnose many times. One must think of that possibility of, am I depressed? Maybe you can ask somebody else to confirm that.
Because I think there's one more question here about, because just today, youngsters Google their symptoms and come up with their own diagnosis.
Yeah.
So is that okay, or is there something that you be cautious about when you Google yourself and should look for symptoms?
Yes. When we are training as doctors, there is something called first clinical year syndrome. That is in our third year, we start seeing patients in the wards. And After a few weeks, we think that we have the same disease because we also have this kind of symptom. To put two and two together, and we think we have the disease. And later on, we realize that it's not so. So many times when you Google, and everything that what you find there, you seem to be having. So it's always good to consult somebody, not just depend only on self-diagnosis.
How to overcome depression post stroke?
It's the same way as the other depression. There's not much difference. Um, One has to, it'll take time for a person to come to terms with the disability of the use of hands. Initially, it will be a shock and a depression and an anger against others, against oneself, against God. But we'll soon go through that process and come to accept. Most of us have the ability to come to terms with our defects and our problems. And at such time, someone being with the person, not preaching to the person, but being there, listening, offering a few words of comfort, all these things will help a person. A person who's after stroke needs rehabilitation, how we can use the rest of the limbs to do what he could do before.
There are multiple questions here, doctor, around the topic about when you know that someone is going through depression, we want to help them, but they're unwilling to take help.
Yeah.
So how do we work with them? That is one part. The other part, putting the question around, is when we tell people that are going through depression and they don't accept it, how do we deal with that? So I guess similar.
Yeah, this needs patience. Initially, they may not accept it. They are reluctant. So don't give up. Be with the person, keep talking to the person, and many times, eventually, they may agree. Not, if not for their depression, for some other symptoms that are related to depression. Common example is sleep disturbance. Many times, at least for that, they may be willing to take medicines or see a doctor. Or any other symptom like loss of appetite or feeling tired unusually, they may like to see a doctor. Sometimes they may not want to see a psychiatrist. Oh, I have no psychiatric problem. Okay, let them see a general doctor. And if it's a good doctor, the doctor himself may recognize depression, and any doctor is authorized to treat even depression. It's not very difficult, just a prescription of antidepressants. You can start with that, and when the person feels better, person may be in a better position to seek more help.
Uh, we in India we see some states are more prone to suicide. For example, I don't know about the statistics. The question is there here.
Yeah,
That,
more in Tamil
like,
Nadu, Kerala, Maharashtra.
right. I think here the answer is given as Sikkim versus Bihar. Is there any truth in that? Is there any reasoning behind that?
Nobody has found any reason for that. It's just an epidemiological study. And in epidemiological studies in depression are difficult because it depends on what one considers as depression, what method for research the person has used. Was it just questionnaire method, or was it an interview, or was it any criteria that is used? Therefore, so varying statistics we get. One study that is published shows in one particular study where they interviewed a large number of people and found that 36% of people in India are depressed. That's a very unusually high figure. And people have come with a very low figures also. So it's very difficult to compare these two. Nobody has come up with any specific cause for the difference in these areas.
Antidepressants have side effects, and a friend of mine developed problems with liver. So he had to gradually stop the medication. Now the person is slowly developing the symptoms of depression. Psychotherapy is not finding effective in this case. How do we deal with this?
Yeah, so we'll have to be choosy about the medicines. Older antidepressants used to have more side effects. Nowadays, we have newer antidepressants which have lesser side effects. In fact, the newer antidepressants hardly has any side effect. But if a person has a liver problem, the doctor has to choose what type of medicines you should use. Maybe the medicines which doesn't affect the liver much could be prescribed. If the person is severely depressed, ECT is a very safe option, doesn't cause hardly any side effect.
Just to give doctor a 2-minute break, we will
Yeah,
continue with the Q&A.
sure.
Just to let you know, I know some of you might be leaving the session, but we will continue. The next session will be on overcoming suicide, and we will be looking at that topic exclusively. So feel free to invite your friends and family members whom you want to listen to that conversation. They can just register in the same place, and we will be able to send them the registration link. So we will do that again in the next session. So, doctor, there are many questions. If you are ready, we are ready to
Okay.
ask you.
Sure, sure.
Okay.
No problem.
Sometimes criticism may be the cause of depression.
Yeah.
Is this the case, or how do we handle it?
Not always the case. That's one of the triggers for a sensitive person. So I would say one should learn how to face criticism. And usually these people are people who have a problem with their own self-esteem. Their self-esteem depends on how others esteem them. If your self-esteem depends on what others say, then one can be easily be upset when people are criticized. So one needs to learn how to stand on his own and have a better, healthy self-esteem. As uh, as a Christian, I have often said that one should feel that he is loved by God. And when you believe God loves you and he cares for you and you are God's child, that gives a person a self-esteem that I am not a nobody, I am a child of God. And even if nobody understands me, I can go to my God understands me. And that's, I found very often, that helps people to face difficulties and criticisms. And when they feel upset, that's the way to face. And this has been the experience of people all over the centuries.
I think you answered that question in the other way, because one of the questions here is depression from the devil, or does it come from evil forces around us?
I would say depression is like any other, like you deal with any other illness or disease. Uh, that for that question, I would say we are not controlled by the devil. We believe God is in control. Yes, the devil can tempt us, test us, but God is all powerful. Therefore, we don't have to be afraid. We need to go to God and ask God to help us.
Okay, some questions I think we'll take it next week. How can I help a friend who is really depressed and has suicidal thoughts
Okay,
when
sure.
she doesn't open up? Do you want to answer that now, doctor?
Uh, yeah, I can
Okay,
briefly
please go ahead. Yeah,
say,
go ahead. Go ahead. Yeah.
yeah, anyone who talks about suicide is in risk of committing suicide. In fact, they found that many people who have committed suicide had in fact mentioned about suicide sometime earlier and nobody took notice. So that's very important to really take it seriously and uh, be with the person. Prevent. We probably be talking next week about the ways, some of the ways to prevent suicide. But it's important to consider the risk of suicide in such people.
My my father is having schizophrenia for more than 25 years and taking antidepressives. Now his age is 60. Kindly suggest what we could do for him at this age.
Okay. Schizophrenia and depression are two separate diseases. A person with schizophrenia can also develop depression. That is true. But these are two different diseases, and one has to be sure whether the diagnosis of schizophrenia was right or not. Because a 60-year-old person, if he was diagnosed as schizophrenia maybe 20 or 30 years ago, we need to review that. Was it really schizophrenia, or it was depression only? If it is schizophrenia, the person should continue on medicine lifelong, usually lifelong. If it is depression, a person need not continue it lifelong, but only when the person feels depressed. It would be best to consult the psychiatrist whom the person is seeing for any further advice, because only the person who sees the person only will know the condition of the patient.
I think that is, I mean, you said that because, I mean, we can't like read into a person just over a Zoom call. I think
Yeah,
it's important.
sure. Yeah.
If any person is an introvert and don't like to be social, is that a sign of depression?
No, there are two types of personality. We say some are introverts, some are extroverts, and both are good. Both have their positive points and negative points. Introverts are people who are more self-absorbed. They are more contemplative. So they may look as if they are depressed, but they may not be depressed. But an introvert, if he's unusually quiet than his usual quietness, something more than his usual reservedness, then you should suspect depression.
A couple of people have asked this question. I think they're related. I had an episode of depression 10 years ago. It occurred twice in the last 2 years, and doctor advised pills which have to be taken for a lifetime. Is it okay to be taken for a lifetime? What are the side effects? And I think the other person also asking, is it possible to be completely healed of depression? I'm on medication for last 15 years, but I'm not completely fine.
Okay. Depression, usually we don't advise lifelong, but not much problem even if you take it lifelong, because these medicines don't have much side effects. So it depends on the condition. The person having recurrent episodes of depression, repeated depression, usually we advise them not to stop the antidepressants, take it lifelong, and it's fairly safe. But in general, the depression is episodic. When one episode is over, then they'll be well for a few months at least, and then till the next episode comes. So we can stop, and then the next depression comes, you can restart again. Uh, Again, each case varies, therefore should follow what the doctor says. But I would like to reassure you that the side effects are not much, not significant. Even if you take lifelong, nothing much will happen. You don't have to be afraid of that. Uh, Again, it depends on the type of medicines. Some slight side effects, which may be more with one medicine, less with another medicine. The doctor can choose according to the side effect which is affecting you, can change the medicine also.
Uh, I had suicide intentions, then too scared about sorry, I'll read again.
Yeah.
I had suicide intentions, then too scared about suicide and returned to my routine. Is it normal occurrence in a common man? Many times I face depression.
No, it's not a common occurrence. Some people can get suicidal thoughts even without being depressed. Uh, Maybe due to various events, a failure in an exam, failure in a love affair, or what various reasons. The person may not be depressed, but due to some causes, a person may have suicidal thoughts. But if you feel you are getting suicidal thoughts without any such triggers, then you should seriously consider the possibility of having depression. And it's always good to tell someone that you have these thoughts. Don't think you can deal with it yourself. You may be, but it is risky. Always tell somebody when you can tell before you become too depressed. Uh, so you must make all precautions uh, so that you don't give yourself any chance to commit suicide. Very often, doctors, psychiatrists make a pact with the patient, a promise from the patient that I will not attempt suicide till tomorrow morning or till next Monday. That often helps. Even a simple thing like that prevents a suicide. So if you have suicidal thoughts at that time, you should at least tell a friend or somebody. Better to tell a doctor or a psychiatrist.
Some people say that if you are truly saved in Christ, we should never get depressed. I guess it's about if you're too spiritual, spiritually okay, you never get depressed. What are your comments on that?
That is not true. As I already said, very spiritual people, even prophets in the Bible, have gone through times of depression. Uh, uh, People even said, why was I ever born? Crying out. This is quite normal. If you read the Bible, even Jesus, Lord Jesus, before he was crucified, he went to the Garden of Gethsemane to pray, and he said, "My soul is so heavy and depressed." He cried. So, depression, whether you're spiritual or not, it's a normal. It can happen to anybody. So it is not right saying that if you have strong faith in God, you will never get depressed. It's like saying if I have faith in God, I will never get a headache or a fever. It's not like that. Anybody can get.
How can we bring positive vibes or happiness to parents who stay alone when we are not able to stay with them all the time because of work outside?
Yeah. The important thing is communication. Nowadays we have mobile phones, WhatsApp, calls. We should always keep communicating with them. That is the most important thing, even if you are not able to visit them. Now, especially in this COVID times, that's what we are doing, communicating with each other. That will be the most important. The other thing is, can we get them in touch with their neighbors or some friends, some clubs, some meeting together, playing games together? Can you make arrangements even if you're far off, calling some friends, neighbors, so they can meet them? These are some ways we can keep in touch with them so that they don't feel lonely and become depressed.
What is the difference between depression and anxiety?
Yeah, they are different. Also, they can occur together. Anxiety could also be a symptom of depression, especially in older age. When they're depressed, they get what is called agitation, restlessness. They are not able to sit still. That's a sign of depression. But in general, in younger people, anxiety about what's going to happen, or about the future, or some event uh, can happen in young people. That is anxiety, and that is disproportionate to the risk or the stress that is anticipated.
I am dealing with happy depression. So what should I do?
I need to know a little more about that. What do they
Okay.
mean by that? Is it a person who is smiling, or yeah? If you feel that person is depressed, keep talking to the person. After a few minutes or hours of smile, the person will come down to reality and will start saying about the depressive ideas. So that's when you can talk more about that. And help the person to face the reality. Now, we need to be careful. We should not be going there and advising the person, but listen to the person. By listening, you may pick up something that the person says and pick on that rather than going and preaching at the person.
I wanted to ask about how depression can also trigger the presence of other disorders like body dysmorphic disorder, bulimia, or anorexia, or kinds of hallucination. Can any existing depression play a major role in a person having other disorders too?
Yes. See, many people who are depressed can present with many of these symptoms as well. So sometimes it's difficult to say, is it a symptom of depression or is it the person having both the disorders together? It's difficult to distinguish sometimes. Many of these disorders, they tend to respond to antidepressants, interestingly. So it is safe to treat people with antidepressants sometimes if they have some associated symptoms of depression, though it may not be much. And uh, especially a problem like obsessive compulsive disorder, OCD, often responds very well to antidepressants. In fact, they need a higher dose of antidepressants than the usual dose needed for depression. So in some way, many of these things are related, not all.
Does doubting your spouse lead to depression?
Can, but doubting unusually without sufficient cause or more than what normally anyone would do could be a sign of a delusional disorder or a paranoid disorder. That would need treatment. And with treatment, usually many of them do well. Treatment, not antidepressants, but other medicines.
Is overeating a way of coping with depression?
Yes, sometimes eating less, usually we say eating less is a sign of depression, but in some people, sleeping more or overeating could be a sign of depression. But everyone who overeats is not depressed. We should not be quick to think like that. But overeating could be a sign of depression. Always, before you diagnose depression, never diagnose it by just one symptom. Somebody having sleep disturbance, oh, that's depression. Somebody overeats, that's depression. We should not be quick to jump into the diagnosis. It's usually a syndrome, a group of symptoms. Not only that, they may have other symptoms of depression as well. If so, then we think of depression, not just by one symptom alone.
What is manic depression? Is frequent mood change a part of its symptom?
Yeah, all the depression that I talked so far today, we can call it as a unipolar depression. That means people are normal, they get depressed, again they become normal. There is a condition called bipolar disorder, which used to be called as a manic depressive disorder. There, again, because of this biochemical change that I talked about, I said that the biochemical substances, dopamine, serotonin, noradrenaline in the brain, when it becomes less, person becomes depressed. What happens if it becomes overactive? Then you go to the opposite side. That is called the bipolar disorder or mania. All the things that I said about depression, the opposite of it happens. Person becomes overactive. Person will become very cheerful, have lot of ideas, lot of plans. Person, here again, the person will have deep sleep disturbance, not because the person cannot sleep, but the person thinks the person doesn't need sleep. Sleeping is a waste of time. I have so many things to do. So the person will be very overactive and have a lot of great ideas about himself, herself. That is called mania. That is because the biochemical, the neurotransmitters are overactive. So that needs a separate treatment. They should not be given antidepressants. If you give them antidepressants, they'll become worse. They need probably mood stabilizers or other medicines. And they also can go to a depressive phase. Those who went to a manic phase, they can become normal and they can go down to depression. This is why we call that as a bipolar disorder.
So can bipolar be cured, or is it a lifelong sickness? Can they live with others comfortably, or can the variation in their behavior patterns disturb the normalcy in family life?
Usually bipolar can be treated, but they need to take medicines. It's like asking, can my headache be cured? Yes, it can be cured, but you will get a headache again after some time. So bipolar is an episodic illness. It can be controlled with medicines called mood stabilizers. And if they take it regularly, they can most of them can lead a normal life. If they take the medicines regularly, they may have to, if they get frequent episodes, they may have to take the medicines lifelong, this mood stabilizer, so that it prevents these ups and downs.
Okay, I'm just, I think, running through, see if we have, I think there are a few questions for next week, and also yeah, bipolar we addressed. If the therapy, what do I do if I find therapy expensive, thus inaccessible?
Medicines as such, they are not very expensive. Maybe the treating doctor may be expensive. You may have to find a doctor who is not expensive, because once after you finish your initial consultation, if you need to continue the medicines as such are not that expensive. Again, there are varieties of medicines which are very expensive, comparatively more expensive, and medicines which are not expensive. So you have to make a mention, doctor, can you give me a medicine which is not so expensive? The doctor may be able to, because all antidepressants, almost all are equally effective. There's nothing saying one is better than the other. Even the cheapest antidepressant is quite effective. So it depends on the doctor who chooses. Maybe the cheapest medicine may have a little more of side effects, perhaps. That's all. Not much of a difference. So a good doctor should prescribe the cheapest and the best medicine, reasonable medicine that a person can afford. No point in prescribing a very expensive medicine a person cannot afford.
You say that ECT is a method to treat depression, especially the severe kind. As
Yes,
a mental health professional, all I have read and heard is that it is banned as a form of treatment.
not at all.
Please comment.
Not at all. It is not banned. It is still a well accepted treatment for depression and a very effective treatment. In fact, if you ask me which is the most powerful treatment for or effective treatment for depression, I would say it is ECT. It is not very expensive. It is quite safe. As I said already, it is as safe as a normal delivery. ECT has been studied from 1936 onwards. In fact, ECT came even before the antidepressants came. ECT was the only treatment available earlier. It is still considered to be effective. There's a lot of misunderstanding and lot of hype, shall I call it hype about that in the media and the movies and so on. Therefore, people are biased about it. If you ask any psychiatrist, any scientific literature, ECT is still effective. It is not banned. In fact, they tried to ban in some states in the US some time back. That's again because of misinformation. But all over the world, ECT is an accepted, well accepted treatment.
I am taking on questions who are now still waiting for the answers because I can see them online. Some have left, so I'm not taking those, but we will try to answer all the questions. If not now, but we will try to make sure that they are available on a website somewhere so that it is there for. Can depressive person be volatile or disruptive or very angry?
Um, Not generally, but when a person is depressed, he can be irritable because everything seems to go wrong. He doesn't enjoy anything. Therefore, even a normal thing can be irritating for the person. Therefore, a person can be angry. As such, a depressed person generally is not volatile and shouting, unlike a bipolar, a manic person. He can be shouting and making a big noise. Generally, not. But again, it depends upon each person's personality. There are some people who have an explosive personality even before they got depressed. Such people, when they're depressed, probably that may continue. But generally, depression doesn't lead to explosive behavior.
How do you stay with people suffering from bipolar manic depression as it gets really difficult to manage their constant mood swings?
Right. It can be quite difficult, especially for the spouses and children. Uh, the best way is to get treatment. We have good treatment, mood stabilizers. They have to continue to take that if it is recurrent or according to what the doctor says. And in spite of the mood stabilizers, people can get this ups and downs. So the person who's living with the person should be quick to recognize the beginning of the change. I repeat again, should be quick to recognize the beginning of the change. At the beginning stage, the person will be amenable to come for treatment. Once a person gets a full mania, a person will not come for treatment. Very difficult. And sometimes may have to be forced. In India, it's still possible for relatives to force the person and take a person for treatment. In many of the Western countries, it's not possible. Uh, so it's important to recognize the early change in their behavior, and let's go to the doctor's person may agree.